last Facebook Live for 2020. We're going to basically take the rest of the month off and we're going to start strong the first Thursday of January. So be sure to keep that on your radar. We have some great educators and discussions that we plan. And so I just want to let you know it's always a pleasure to kind of connect with you as nurse educators and to just kind of, bring some innovative strategies as well as relevant guests that really can strengthen and help us transform nursing education and what we do. And so if you're new to this live stream and you kind of stumbled across it, my passion as Keith of Keith RN is to transform and to strengthen the clinical judgment of nursing students so they graduate not only better prepared for the NCLEX, but more importantly, real world clinical practice. And I've developed numerous case studies and resources that are available on my primary website, keithrn.com. I've got a free COVID-19 case study, clinical reasoning, that really helps students understand the essence and practice clinical judgment. So be sure to check that out if you haven't had a chance to. And this live stream link is recorded. So if you find the content that we're going to share tonight valuable, please go to Keith RN, Think Like a Nurse Facebook page. On the videos header there, you'll see the link. Download it, and you can copy and paste that and share it with other faculty who maybe can't be here live because we all got things we're doing, especially this time of year. If you missed last week, I had a great guest, Sam Womble, a new graduate nurse who, in essence, had a book that he wrote called Preparing for Practice that he shared some of the principles with on how we as educators can strengthen and transform how we teach so that our graduates are truly immersed and understand the complexities of real world clinical practice. And so be sure to check that link out. And I think you'll be glad you did. And I also just want to let you know, I do also offer an all-inclusive membership for nurse educators. That's over 110 case studies. And just want to let you know that I have office hours if you're a member every Friday, which is tomorrow from 10 a.m. to 12 noon. And so if you're listening to this and you're a member of Think Like a Nurse, please come into my video live stream. You'll get an email in the morning, and I'd love to connect with you, answer any questions or challenges you might have. Well, let's get to tonight's guest. I am really blessed and excited to share a special guest that I came across. I'm an admin for a Facebook group called Teachers Transforming Nursing Education. That's over 6,000 educators strong. And it's a wonderful supportive community, educators sharing links and resources. And an educator shared this link to an organization called Nurses International. And they were talking about what some of the innovative and wonderful work they're doing to strengthen nursing education in the world, especially the developing world. And so that's been one of my passions as it relates to being involved with medical missions in the past. And so I checked it out and had a chance to connect with Miriam. And Miriam Chickering is actually the CEO and founder of Nurses International, and she's going to be with us in just a moment. She's a maternal-child nurse, an author and nurse educator with a background in product development, business strategy, and consulting. But she's also the founder and CEO of Nurses International, which is a global nonprofit nursing education consulting organization that provides nursing curriculum to 124 countries and is dedicated to relieving suffering in low-resource countries by providing educational support through open access resources through the internet to nurses and nursing schools. And these materials are created with the help of volunteers and has an operational framework titled Listen, Learn, Share, and Serve that uses and improves healthcare worldwide by advancing global knowledge, by increasing access to excellence in nursing education. And I'm excited to have with us Miriam Chickering. So Miriam, welcome to tonight's Facebook Live. It's a pleasure to have you with us tonight.
It's a pleasure to be here. Thanks for having me, Keith.
You're very welcome. And one of the first questions I love to ask guests when they first check in is basically your story, as a nurse and a nurse educator, and kind of what kind of was your story that kind of attracted you to nursing education, and then ultimately to do something that most nurses don't do, which is, form an international nonprofit. So you've got a wonderful story. I just love to get a sense of just that journey and to share that, please.
Yeah, my journey started when I was very small. I think I was about 11 years old when I decided I wanted to impact health globally with my life, and chose the nursing profession when I was still in high school and went to college. Loved studying, and it's been my career, my love ever since.
Okay. And what about nursing education then? So you've been a nurse educator, and for how many years, Miriam, and what kind of context? And then what kind of, what was I love the metaphor, the splinter in your brain that caused you to do something, then to go from nursing education to organizing from the ground up, an international nonprofit.
So I call that the blessings of constraints. My husband is a pastor, and he decided to pastor a small church in a rural setting. And I had been practicing in a high risk labor and delivery, loved my job, was developing competence, still a young nurse. And we moved to this new city, and there wasn't a lot going on. There weren't a lot of babies being born. And so I offered to tutor at my local nursing program, and the director saw me, and she offered me a job. And so I started teaching in that nursing program, and it was such a super easy jump to say, you know what, I am teaching this cohort of students, but I could be teaching every nursing student on the planet with the internet. And decided at that point that it was silly not to use the tools that I had at my disposal to make a big difference. And I was doing a lot of reading and studying on how to leverage different sorts of practices. I'm sure a lot of you have heard of the 4-hour work week. And I read that book, and I started doing a lot of reflective practice, and woke up in the middle of the night and just heard the voice of God telling me it was time to go start a nursing school. And I thought that was absolutely crazy, and that I'd wait 10 years to do it. And I talked to my husband about it, and he said, no, you need to do it now. This is the time. And now there are 200 of us building nursing curriculum, and it's being used in 124 countries. So that's my story.
So when you look at your overall, every organization, Miriam, has a vision that's really like your overriding purpose and then a mission to implement it. And so as you look at just kind of, starting from, just that small beginning, and it's grown, because this was about 5 years ago, correct? That in 2015 is when you started this journey to basically develop internet-based curriculum and resources that anyone in the planet could access, especially in the developing world. Is that correct?
2014, yes.
2014. So give me the vision mission. What is kind of that vision and that mission that really drives what you do? So educators who are listening can kind of get a sense, does this align with me? Is this something that I would like to, kind of contribute to, whether, at any level? And so just briefly highlight that for the audience.
Well, we all know that we have a shortage and a projected increasing shortage of nurses. And nurses make up the majority of the health workforce and provide most of the care activities in the health workforce. And so if we don't have nurses, we don't have a healthcare system. And nurses are capable of so much, but in many countries, they're not allowed to practice at the top of their license frequently. And that's a real shame, because nurses can run a clinic, they can deliver a baby. Nurse practitioners can prescribe medications, and we can do so much to make the healthcare system go and to relieve suffering on a global scale. So if we can create equity in healthcare education and make sure that every nurse everywhere has access to not just a good nursing education, but an excellent one, we can really make a difference in in reducing global suffering. And that's what I want to do.
So in the essence, what does this look like, Miriam? So like in the essence, as you look at Nurses International and this curriculum, just break it down. So we've got, curriculum is complex. Let's keep it simple. What are the things that you have developed that 124 countries, nursing programs in 124 countries are accessing, downloading, and putting to use in their nursing programs? What are educators developing? And then kind of scaffold that with what is it that you're needing right now and are in the process of building?
Sure. So we're building the core courses for a Bachelor's of Science in Nursing degree. And we're just launching, it'll be this week, our maternal-child course, which is the most beautiful thing I've ever seen. Can't wait to get it out. And then in process, we have a nurse educator's guide, a course on clinical teaching, a course for ICU. So many nurses, because of the pandemic, are being thrown into ICUs unprepared. So we're creating a course for ICU nurses, and then we're finishing up our BSN programming.
And so educators, so programs can access this. There's like an online portal, and they can download these resources at no cost. Is that correct? Or is there, what is kind of the, you talk about the equity and the access, what does that look like?
Yeah, so people just come to the website, they sign up, they download a link or a zip file, and the courses are right there. And we add more all the time. So like I mentioned, we have one coming out this week, and we'll have several more coming out in the weeks and months ahead. All of these courses are being placed on a learning management system. So people who get confused by very complex files, they can just go to the learning management system and click and see what the course looks like that way. And that'll be available by the end of the month.
Okay. And so with these courses, Miriam, is there like PowerPoint? I mean, if you just break it down even further so educators can kind of get their head around what is then accessed, and, when an educator in another part of the world is needing some good quality, like the maternal OB content, when they access it, what are they going to see? And what is it that was specifically developed?
The most important piece to the course is the blueprint. And the blueprint is essentially lesson plans plus links to the syllabi. We have clinical and didactic syllabi, all of the skills, videos for the skills, rubrics, grading rubrics, there's assessment items, there are case studies, PowerPoints, essentially reading materials, essentially every single thing that you need to teach a course.
Okay. And so when you look at, in the big picture, when you look at population and global health, Miriam, and where the struggles are internationally, what are the things, what are really the common themes in the low and middle developing world that is really, hindering patient care outcomes and really contributing to the poor, the high rates of infant mortality and other really poor determinants of health? What are those common themes, and what is it that nursing education can do as you train and improve the quality of nursing to address these disparities?
So Keith, I think you know the answer to this one. It's all about clinical judgment. Many nurses are taught using chalk and talk, and they're just expected to memorize information. But that doesn't translate to critical thinking, clinical reasoning, and clinical judgment. And until we get there, where it doesn't matter how many nurses we stamp a piece of paper and give them a license, if they don't have good clinical judgment, we're not making an impact. And so the most important thing that nurse educators can do when they have opportunities to teach internationally is to teach those very important problem-solving skills and to teach methods for problem solving. So don't just teach how to solve a particular problem. Teach your students a method or a framework for problem solving in an ongoing manner. Teach your students how to develop standard operating procedures, policies, guidelines, checklists, rubrics, to get on the internet when they do have access and find these tools that can back up their practice, because the tools are out there. We don't have a lack of tools. we have a lack of teaching people how to use what's already present in the system.
And one of the things that I even see, Miriam, I don't know how well this is embedded in your curriculum, but a lot of nurse educators are not well acquainted with Chris Tanner's model of clinical judgment that was published in the literature in 2006. And Tanner's framework is essential to developing that clinical judgment, as it, in essence, kind of builds on nursing process. We've laid the foundation of nursing process in the 5 steps, but Tanner's framework of clinical judgment kind of builds on that with those additional steps of, when you do the assessment of your patient, first step of nursing process, what are you noticing that's kind of relevant or a red flag? And then what's the meaning of this clinical data? Those are higher level thinking that leads to either, clinical judgment, and the right choice is made or break. If you don't notice and you don't know the meaning of what you're seeing and you just let it go by, bad outcomes happen. And so do you use case-based approaches, Miriam, to developing some of this? And so how is that practically embedded currently in your curriculum, and how would you like to strengthen that?
Well, our goal is to have a mini case study for every learning objective in a lesson. But we still can improve, and there's ways that we can do better that we're working on. And you've been such a pivotal part of that. So thank you for coming to our meetings and talking to us about Tanner's model and helping us ensure that we are giving the people who are using our materials the education that they deserve.
Mm-hmm. No, and it's my pleasure, and I'll continue to do what I can, Miriam. I've got a lot of platters. I know, like you're a crazy busy woman as well, spinning very fastly. Sometimes you drop a few things, but my heart is there, and rest assured we'll continue to stay connected. But so when you look at just what educators can do, Miriam, when you look at what are your current needs and priorities right now at Nurses International that you're working on, that anyone who's listening to this live stream, I've got your website on the page. I also have got, for example, ways they can volunteer, which is, again, just a sub page on the same website, just the volunteer hashtag. I would just really, I'd love to just get a clarity so you could really communicate very clearly, what are you needing right now? And what are some of those things so educators can say, boy, I could do that. And you're not looking for 30 hours a week. You're looking for 2 to 4 hours of a project, from what I understand, Miriam. So just kind of break that down for those educators that are listening.
So our current projects, Fundamentals of Nursing, a Nurse Educator Guide, ICU a course, and then a course on clinical teaching. And so what we do is we get a group together of about 10 volunteers, and we meet 1 hour a week, and then we have between 2 and 3 hours of homework each week. And by the end of 3 months, we have a new course to share with the whole world. So it's an amazing investment. And we try to do tons of overlap. So for instance, the nurse who is heading up our ICU course, she's doing it as part of her DNP project. We've had people who are getting EDDs come and do a lot of their optional hours with us and get cross credit for their programs. People who want to pivot in their careers from one academic discipline or focus to another will often come to us. And we've had people who have been teaching in bachelor's programs and wanted to teach in PhD programs and have a global focus. And through their work with us in a few years, they were able to make that pivot. So I feel like there's this beautiful place where your heart overlaps with your work, and that overlaps with your academic pursuits. And when we can find a way to incorporate people's academic work and their heart and their mission with their workplace, that is the sweet spot. So we work really hard to make sure that every volunteer, they're giving, but if possible, that we're putting them in a place where they can receive a blessing too.
And you mentioned too, Miriam, that even nursing students could actually contribute at some level, that it doesn't have to be a master's or a doctorally prepared nurse educator, that actually, I can see some, for those, for those advanced students and working in a capstone or a community public population health course, this would be, is there opportunities to kind of, I wasn't clear. I just like you to highlight what those student opportunities could be that are just basically contributing to what you're doing.
Yeah, so we love to pair students with experienced faculty to do drafts, to draft multiple choice questions, to help with slides. There are all kinds of things. It's quiet work, but it's work that matters. So create a multiple choice question and thousands of students will use that to learn. So it's a beautiful way to do quiet work on your computer. If you're a student, you're learning while you're doing the work, but then so many others learn from that too.
And so if you got students maybe who are interested in being an educator, so where they are kind of like, are they're even thinking ahead that they love to teach and they may want to go into nursing to ultimately be an educator, it sounds like that kind of volunteer work would be kind of a nice dovetail of just kind of, understanding just how to, just doing some of those very basic skills that are essential to nursing education.
Yeah, we've had a number of nursing students. I'll tell you about one exciting piece that's happening. I'm also the chief executive officer at nextgenu.org.
Yeah, I was going to pop that. I was just going to get a little bit. I wanted some more information on that whole project as well. So you can segue and I'll let you keep going.
So we're doing a course on cervical cancer for the US CDC, but we have colleagues, there are 20 of them, they're all students from Saudi Arabia that are helping us create multiple choice questions for the cervical cancer course. And it's wonderful because a lot of them do want to teach. And so we have a very defined process where we mentor students in the entire instructional design process. It's amazing to see the growth where they move from writing an MCQ to crafting an entire activity to then eventually learning how to structure a course.
And tell us a little bit about NextGenU, Miriam. So kind of, that's another project that I don't know where that came in 2014. Nurses International was kind of your passion that you birthed, and it seems like it's doing some phenomenal work. Where does NextGenU kind of fit into this network? Because you're also the CEO of this nonprofit as well, correct?
That's right. So the same night when I woke up and I said, I'm supposed to start a nursing school for the whole world, as soon as that happened, I thought, oh, medicine needs this too. But I didn't know how to reach physicians, and I'm not a physician. So I didn't have an opening or the right network. But Dr. Erica Frank is the preventive medicine research chair at the University of British Columbia. And in early 2000, she started NextGenU. And that reaches up to 74 U.S. med schools, 140 universities. We just signed an agreement with the largest university in Pakistan that has 1.4 million students. At NextGenU, the courses are used in every country on the planet. So truly global reach, and we're working very hard to start a med school. We have an MPH program and nursing. So our goal is by 2025 to have an entire health science center.
That would be online and for anyone who wants it.
Completely online, completely for free.
Awesome. Do you have any kind of testimonials, especially from nursing programs, Miriam, in the developing world, as far as just in general, I just want to kind of, and we're going to close here in just a moment or two, but I would really like to get a sense of just kind of, when you just look at the real world impact of the resources, like for nursing education and programs in the developing world. Yeah, so I'm just,
this is my favorite story.
Yeah.
Two of the people on our staff, they're nurses. They live in Nepal. Their names are Bimala and Sita, but they went to nursing school in Bangladesh. And one of the people on our leadership is Alex Berland, and he went to Bangladesh and started a nursing school there. And then he gave the materials to Nurses International, and we use them as references for our courses because they help us understand what low and middle income countries need. Bimala and Sita graduated from his program and are now working for Nurses International and creating nurses training for the entire world. And if that's just the most beautiful full circle story about the kinds of impact that we can have when we're really dedicated to making a difference where there's a need. Another story, our former director of professional development worked in Kenya and was the nurse educator for a large hospital there. And he contacted me and he said, I've been using all of Nurses International's content, and I want more people, more hospitals to have it for professional development. And I said, well, do you want a job? He said, yes. And he came and he started to work for us. And so there's just this beautiful synergy that happens when you're willing to throw your bread out on the water. When you're willing to give, you get so much back.
That's awesome, Miriam. As you just kind of, in closing, if you were just to kind of, when you look at, you really have a very empowering vision of what nurses can be and do. Sometimes as nurses, we belittle ourselves. We're just a nurse, and that kind of, is still prevalent with a lot of, within our profession, because we seem to sometimes embrace powerlessness, within a patriarchal medical system. And there's a lot of barriers where nurses are not able to really rise up and I think take the kind of initiative and leadership they could in healthcare. But you've got some encouraging thoughts for educators, but especially nurses, that I'd just love you to share in closing.
A nurse on a busy med-surg floor, taking care of 8 patients and having an admission and 2 discharges and a rapid response. I mean, that's so common to have all of that in the same shift. Mm-hmm. You're juggling more and giving more of yourself than any executive that I've ever met. You don't need a leadership class. You have those leadership skills. They just have to be contextualized differently. So if you're a nurse, you're a leader. If you're a nurse, you do have the skills to lead and to lead globally. I'm a bachelor's prepared nurse, and I'm the CEO of 3 different organizations with endowments, funding from CDC, WHO, colleagues all over, funded over $1 million grants. Go get as much education as you can, the best education you can, and as much higher education as you need. But don't wait to lead. You can lead now.
And you do that. What I see, Miriam, is that you lead by example. And to me, I think the greatest example was that of Christ, who by his serving showed us the path that those who serve are greatest of all. And, those are the values that as a profession and as people, we need to embody and we need to role model to really make the kind of difference that our world needs, especially for such a time as this. So that would be my little end cap to that. So thank you for sharing that.
Thank you, Keith.
Yeah. Well, as we look at just kind of in closing, what questions do you have for Miriam? When you look at just kind of, what's a takeaway or just a question that you have, I've got the chat box open. So for those of you that are with us live, if you've got a specific question or comment, now is your time to put that in the box so that we get a chance to respond to it live and see what we have. And until we get we'll just wait. Sometimes there's a delay, Miriam, before things kind of, but I've got the first question from Amber, who's just wanting to know, how can we access this material? If we're nurse educators and we're saying, boy, I'm struggling with content in XYZ area, is there, is there any, can American educators download this without any shame and guilt and look at what you've developed, not only for, what's there, but also to say, could they, do they have consent to use it to strengthen their curriculum if it would help them.
Please do. The more the better. And we welcome feedback. And more than that, tell us what you need. What do you need in your program? And let us help you develop it.
So if you were to, where can they find it, Miriam? Here's your website for Nurses International. If you would just, what is basically, once they're on the website, where do they go from the website to access some of the open access materials?
I believe there's an open access tab that you just click on and you go right to it and download the materials.
Okay. So is it one of the header links there, Miriam, right on the home
Yeah,
page?
it's on the top. It's on the very top, and it's the very first thing. It says open access.
There you go. Open access header link, the very first one. So if you just go to nursesinternational.org, you can check it out. So anyone who's listening today, you can get a chance to kind of check it out for yourself and just and look at that. And so Amber is just saying she's not looking at it for herself, but simply says, I teach in an international nursing program, but I don't need content now, but may in the future. So I'm just curious, Amber, where are you teaching? If you've got a moment to share that, you must be international or in another country, or are you doing this by video, by live stream? So if you have a moment to comment, that would be amazing. Other than that, I'll wait just a little bit, Miriam. If you, she's in Shanghai. So she is, I do believe Shanghai is China, if I know my geography, right, Miriam?
We had a team doing consulting work there for 3 different nursing organizations last year. Carla Kreider, who's in your group, and Kathleen Capone, who's our academic coordinator, went there. That was a beautiful experience for both.
Awesome. And you know what? One of the, just for those of you that are, if you're looking at it for the live link, this link is now in the chat. And so this is the open access link. You can just click the link that's right in the chat, but that is the actual link right there. And I do have a question from Pauline, who asks, do you have content for virtual sims? Anything of that nature?
We have not created content for virtual sim, but I have links to free virtual sims if you'd like. You can email me, Miriam Chickering at nursesinternational.org.
Yeah, let me pop that on the screen, Miriam, just so that we get that for those of you that would like to get in touch with you personally with any questions or anything that they would like to do in follow-up.
And Pauline, I just have to plug Keith's Nurse Educator group. He's got so many resources in the resource section. If you go and you put virtual sim in the search box, you'll probably get way more than you could ever use.
Yeah. You know, when you've got I think almost 6,600 educators from around the world, most in the United States and Canada, but they're sharing everything, Miriam. They're sharing files, they're sharing your website, they're sharing tools they've developed and other links to where the good stuff is. And so absolutely. Only one little hitch though, it's a closed group. So I'm not quite as open access as Miriam. I want nurse educators. I don't want students or spammers. And neither do you if you're an educator in the group. You don't want spam posts. So you got to tell me you're an educator and where you teach, so I'll let you in. Otherwise, if you just don't even tell me where you are and there's nothing in your biography that you're a nurse educator, I actually dismiss. I don't let you in. So that's just a caveat, not trying to be mean, but I'm trying to control the culture and not let it deteriorate from the quality that we have, which I'm so thankful for. So anyways, and that's a great plug, Miriam. I forgot that there's all this stuff that resides on the Facebook page that if you basically just know how to search for it, you can just, there's files, Word documents.
Oh yeah, more than once when we've looked at doing a course, I come to your Facebook page and search what's been added because there's always great stuff.
Yeah, no, thank you for sharing. And Pauline just says she's just getting ready to do a DNP project, either on virtual sim or transition to practice.
Ooh.
Now, Pauline, I'm going to give you a little advice. do both. You could do both. Maybe consider how you could use virtual sim to improve transition to practice. That's just a thought. I'm not telling you what
So,
to do.
Pauline, one of our faculty at NI has done tons of publishing and built entire simulations, virtual sims inside of Second Life, had funded projects. She would be an incredible mentor for you. So contact me if you need a DNP mentor and if you're interested in doing a project that could be used globally in virtual simulation.
Awesome. Yeah, it's, what I've learned from you, Miriam, like when I was on the Zoom call with just sharing some of my clinical reasoning work as well as my dissertation, it was the coolest thing to have a video conference. And you got educators from Egypt, the Middle East, as well as, here in this country. It was just like, I loved it. I just said, this is amazing. And it's just incredible to have that kind of almost a global network.
Oh, so you know what, Keith, we should talk about for a sec.
Yeah.
One of the amazing things that Keith has done is he put together this little program, a way to evaluate your nursing program. And we took that and put it on a spreadsheet. And we're going to have the nursing programs that use our content fill it out. And then we're going to do an analysis. So if you want to participate in a global nursing program analysis, you email me and we'll get that done, because I think what we're going to see probably over 80% overlap in nursing programs. And what that means is we have tremendous power to collaborate.
Yeah. And what I actually shared was kind of the splinter in my brain during the curriculum class with my PhD students. After we did the class, kind of how can we basically develop a clinical reasoning curriculum? Kind of in essence, how can we lay the foundation of really that curriculum shouldn't be so willy-nilly that we've got this model, that model, and this model. It's like the foundation of clinical judgment and decision making. There should be a foundation that we can lay, and using the curriculum to do so. So anyways, that's just kind of where that came to be. And I'm so thankful I had a chance to contribute, and they ran with it. So again, for those of you that are interested, please connect with Miriam. You've got her email. There's no further questions in the chat. I want to thank you all for attending tonight's Facebook Live. And Miriam, you're back. But you know what? I'll let you close it out with the final thought or comment. It's whatever you want to share. This is your time.
I think what I'd like you to know is that you have access to the internet. If you're watching this and you're a nurse educator, you have all the tools you need to change the world right from home. You can do it. Join us.
Thanks, Miriam. It's been a blessing, and thank you so much for sharing your work, and look forward to opportunities to collaborate in the future. And thank you for being our guest tonight.
Thank you, Keith. Bye for now.
Blessings. Have a good night, guys. Take care.